5 easy exercises for joint arthritis or osteoarthritis of the knee. Are you tired of constant pain and stiffness in your knee? Are you starting to worry that the only solution could be surgery? Well, relax. I'm going to show you some very simple exercises that could get you out of pain, stabilize your knee, help you walk, and help you feel better today. In this video, I'm going to guide you through 5 very simple beginner exercises to reduce pain, improve stability, and improve the longevity of your knee. And they're really simple to do, and they don't require any special equipment, are perfect for taking care of the first steps toward pain-free living. I spent over 30 years helping people with knee pain, eliminate pain, stabilize their knee, get back to all the things they love to do without drugs and surgery. Hundreds of my patients have seen incredible results, and it's very possible these exercises are the same as for you. By the end of this video, you're going to have a very clear step-by-step beginner routine to relieve knee pain and improve your stability and mobility. And this is just the beginning. This is part 1 of a 3-part series of helping you eliminate pain, stabilize your knee, improve your quality of life. I'm going to show some advanced techniques and little creative advanced techniques that'll elevate your knee pain recovery to the next level. So again, pay attention, subscribe, stay tuned to my channel, and be ready for a new video every week. Start feeling better? Are you ready for that? Let's dive into it. I'm Dr. Gregory Kramer. I'm a Livonia chiropractor with over 33 years of clinical experience. I've seen over a couple 100,000 patients. I've had the privilege and enjoyment of helping people just like you. I'm certified in chiropractic biophysics, which is a structural rehabilitative approach. I specialize in treating knee pain, disc problems, peripheral neuropathy, and plantar fasciitis. I use a variety of corrective methods: spinal decompression, knee decompression, targeted exercises to help people eliminate pain, avoid surgery for the knee, spine, and foot, so that you can live stronger longer. Remember, if you like this information, like it, share it, and please subscribe. Every week I upload a new video to help you live stronger longer. Osteoarthritis of the knee is a degenerative joint condition where the protective cartilage that cushions the knee, or the top of the tibia and the bottom of the femur, start to wear down over time. Now, why does it wear down? Well, there's many reasons, but a couple basic ones are weight. That could be a problem. You had an injury that was never fixed, but sometimes the tracking of the knee joint can be off. Another interesting reason is, from a chiropractic perspective, if your body is misaligned, like if your rib cage is shifted to one side, your rib cage or your torso is 2/3 of your body mass. If you have abnormal weight bearing, that's going to put abnormal pressure on the disc, the hip, and the knee. So sometimes, just by balancing the spine, we take tremendous pressure off the knee. But that's not the focus of today's video. Today, what we want to do is very specific rehabilitative exercises to strengthen the muscles around the knee. We want to improve joint stability. We want to improve joint mobility. That's your ability to move, so that you can walk, stand, and bend like you did years ago. This not only reduces pain, but we want to improve function. And we really want to prevent further deterioration so that you could go back to doing the things you love to do. Now, why did I choose these exercises? Well, one, when I say beginner, we got to start somewhere, all right? No exercise should hurt you. But the first thing we're going to talk about is self-massage. And the reason we do self-massage first is that we want to work on what we call movement prep. All athletes work on movement prep. So, for instance, before I work out or lift weights with my legs, I want to make sure my knee joint is moving nice and smooth. And one of the ways we do it is self-massage of the muscles above and at the sides of the knee. What this does is it allows the patella or your kneecap to track nice and smooth. So we don't want to grind our knee joint. We want to exercise our knee joint once it's starting to move nice and smooth. The next thing we're going to show you is a hip stretch. Well, if you listen to any of my videos, if your hips are stiff or weak, it's going to put increased demand on your knee and spine. So we want to give you a simple hip stretch. Number 2, we're going to show you how to strengthen both the outer part of your hips, called your glute medius, and your quads. And we're going to do something called a chair squat. And the 4th exercise is we're going to walk backwards. Now remember, if you feel you're unsteady and you have nowhere to walk backwards, then don't do it. Make sure it's safe. But walking backwards, most people can do. It's very simple. It's a toe to heel, very slow motion. And if you have a treadmill that you can unplug, or a non-motorized treadmill where you can hold on to something, it's a great exercise to start working at the terminal, at the end of the knee, extension motion. So it's a gentle exercise. And the last exercise we show is for the front of your shin, called the Tibialis Raise. When you elevate your toes, you're going up on your heels. And the reason we want the muscles in the front of our shin to work better is those muscles help to dampen the shock of every stretch. So there's a reason I showed you these exercises. Now, before we begin, we want to test yourself. So what we're going to do is we're going to have you do a chair squat. And I'll demonstrate that in a moment. And I want you to sit down. I want you to focus on sticking your butt out, hands going forward, pushing your knees out, and gently sitting down. And I want you to notice either pain, lack of mobility, or lack of stability where you're falling all over the place. And have someone watch you. And if you notice your knees kind of go in, that's another issue. So that's your test, remember? And then we're going to do some of these exercises, and that's your treatment, and then you're going to retest. But over time, if you test with the chair squat and then treat yourself with the 5 exercises I showed you, and then retest, you're going to learn what's best for you at this time. So stay tuned, get ready to be pain-free. This is our test. We're going to squat to the level that you feel comfortable. Now I have a couple pads here to make it easier. So when we squat, first movement is we stick our hips back, arms go forward. That's called a hip hinge. Feet about shoulder width apart. We're going to sit down slow and then stand up. Okay? If that's easy, then go a little lower to a chair squat. If that's easy, then we go all the way down and come up. Now I want you to note, look at my knees. Do my knees go in? Do you only go partial? Do you have pain? That's your test. All right? Now, here is our first exercise. We're going to do a massage stick. Okay? Shannon, can you hand me a massage stick? So what a massage stick does, it's a simple tool. Now, if you don't have one, you can get these on Amazon, or you might even want to use a rolling pin. So what you're going to do is you're going to do self-massage. This is your knee. This is the top of the kneecap. You're going to go on the inside, and you're going to spend approximately 60 seconds. 20 seconds on the inside, 20 seconds on top, 20 seconds right here. And what you're going to do is you're going to focus on the last 3 or 4 inches. And the reason we're doing this, we want to soften the muscles so the knee, the patella, will track. This helps a ton. Okay, so, and you start out very slow. You're going to do this about 20 seconds, 20 seconds, 20 seconds. You're going to do both knees, and then you're going to squat. Now, if you need something more vigorous, pay attention to our next video. We'll show, but this is good to start for the most people. Okay? So, exercise 2 is our hip stretch. So what we're going to do is you're going to put your foot on top of your knee, and this is called a figure 4. And what you're going to do is 60 seconds per leg. Now, if you can't get your foot up, then do the best you can. Put it on your shin and push down like this. So what we're doing is we're holding down for about 20 seconds, then relax. Kind of shake it off, do another 20, and then relax. So that's approximately about 60 or 70 seconds. And you're going to hold, chest out, push that knee. You're going to feel a stretch in the top. You do both sides. So that's about 2.5 minutes of exercise. The second exercise we do is we're going to do a banded squat. So what you do, as you can see, I'm putting on the band, okay? And this band, what we want, very simply, is to push our knees out. We're going to that's using our glute medius. That really helps both knees and spine. And so what you're going to do is feet shoulder width, and your goal is to keep the knees out. And we're going to slowly squat. Keep the knees out, stand up, squeeze our tummy, squeeze our butt at top, push the knees out, stick our butt out, slowly squat, stand up. Now remember, if the depth is too low, then we use a pad underneath our rear end, and what that does is it makes it a little easier. okay? Once you can do 20, 30, 40 squats, I'd start at 5 and I'd add a few every week. I'd work up to 3 sets, resting 1 minute between. When you can do 50, 50 without pain that day or the next day, then you can work on going a little bit deeper. All right, walking backwards, very simple. Heel toe, walk backwards. So we walk forward and we walk backwards, real slow, real slow. Now, if you can hold on to something like a old treadmill or treadmill not plugged in, where you hold and you push, heel, and you're doing toe heel. Toe heel. When we walk normally, it's heel toe. So we push off with our toe, heel, toe, heel. Okay? And then the last is, and walking backwards, I would say about 5 minutes. Figure out how you can do 5 minutes in a safe manner. Tibialis raise, we're gonna go, hold on to something, elevate your toes. Can you see that? Great. If you want to make it a little harder, you go on an angle. And again, as we build those shin muscles, it helps absorb shock when we walk. So we showed self-massage above the kneecap, a minute each leg. We showed the figure 4 where we are stretching like that. We showed squatting with putting a band. We showed walking backwards. We showed tibialis raise. Again, gradually build up. 3 sets of squats, a minute of self-massage, a minute of doing the hip stretch, 5 minutes of walking backwards, and try to do, again, about 50 reps of elevating your toes, starting out slowly. The key is consistency, progression, and pay attention to whatever helps your squat easier. Whatever makes you squat easier is beneficial. And then we're going to show you more advanced exercises on the next video. With these beginner exercises, you now have a very powerful, easy to follow routine to start managing your knee pain or osteoarthritis from the comfort of your home. By incorporating these movements into your daily routine, you're going to strengthen the knee muscles, you're going to work on your balance, you're going to improve your mobility and your stability, and that is going to help you enjoy life. That means better walking, better standing, going to your kids' and grandkids' ball games. And remember, the most important thing is, 1, don't hurt yourself. 2, you got to stick with it. And 3, you got to gradually progress. It doesn't have to be hard, but we want to progress. If you can do 10 squats, then you do 12, then you do 14. But over the course of a year, when those squatting numbers get up, especially pain-free squatting, that's going to help you tremendously. Now, if you found value in this video, what I'd like you to do is like it and share it, okay? And in the comment section below, you tell me which exercises helped you to squat better. Was it the massage stick? Was it the squatting itself where you're pushing your knees out? Was it the figure 4 hip stretch? Tell me, I want to know from you which exercises helps you squat better with better stability, better mobility, and less pain. Remember to hit that subscribe button if you want more tips on how to relieve pain, avoid surgery to your knee, spine, and foot so that you can live stronger longer. In the next video of this exercise series, I'm going to guide you through intermediate exercises to further strengthen and stabilize your knee. Go watch that video right here.